Hi, it's Kevin Bates here. Now, I've been a bit quiet over the last few days because I've spent the last 3 days in hospital. Before you worry, it was just monitoring my son's asthma because he got a chest infection and everything's fine now. But one of the things that struck me while I was there is the amount of record keeping that needs to be done in order to monitor a patient, and how a lot of records just go missing or are not even made because it's quite a tedious manual process. And in particular, looking at the parties involved, you have nurses and doctors, you have the patient, you have all the medical equipment, you have medication, and all these things really technically should be written down and time-stamped in order to have a complete record of how the patient's condition is at any given time. And we had a lot of conversations where I was trying in my sleep-deprived manner to recall when what was done and who received what. And a lot of the data just basically went missing. So I found myself thinking, if the monitoring devices were IoT devices with their own identity, if the patient bracelet had an ID on it that identified the patient and had a tag in it, and similarly if all the doctors and nurses had these kind of things, then all this stuff could firstly be automated, so that when an oxygen saturation monitor was put on a patient, the data would be completely logged and time-stamped, so you know when what reading was received. And similarly, by putting it on a blockchain and giving doctors and the patient the rights over the data that is appropriate, you'd be able to actually share parts of the data to be able to conduct useful research. For example, back to oxygen saturation, there's surprisingly little research out there as to what is normal, what normal readings are over time for people. And of course, as an individual patient, you don't want to share all your medical data to just anybody in the world, but if that could be anonymized, then we would have an awful lot of useful research material that would allow us to actually work out what is normal and what is alarming. So we're not there yet, but I see great potential in the future in these kind of systems that I believe we are moving towards slowly but surely, for everything from improved patient care to a lot of research opportunities. And I think that in a sense, in medicine, the sky's the limit if we can just get our act together. Now, this kind of stuff is not easy. Organizing the ownership and flow of data is not a trivial problem, but we're hacking away at it bit by bit. And I'd kind of like to think that blockchain may well form the backbone for gathering, storing, referencing, and releasing relevant data as and when it's needed. And of course, this carries over not just from medicine, but it goes into all sorts of other things. For example, if you swap patient for car and monitoring equipment for diagnostic sensors on the car and so on, then exactly the same thing can apply to automotive, that cars basically become self-diagnosing, and it's not a question of you're driving down the road and suddenly you hear a horrible grinding noise. Instead, your car can actually send a message saying, no, you need to go to the garage now. And this kind of does happen on the dashboard, but how many of us actually pay attention when the yellow engine fault light comes on and immediately rush off to the garage? We don't know how significant it is. And also, there's a wider thing in terms of data for a whole batch of cars, that when a car company releases a new model, it would be nice to know, what are the failure rates for various components over time for this particular vehicle without compromising the privacy of the individual owner. So again, all this kind of stuff translates equally across from medicine into automotive or into all sorts of other sectors. I think there's a lot of opportunity here, and I'm sure that it is inevitable that eventually the way that we gather data will change and grow, and we should all ultimately benefit from this. Anyway, there's a post on data gathering. It's gone on a bit longer than I had intended, but I hope you found it interesting. See you in the next video soon. Bye for now.